So the struggle is real. In America, 75% of adults have one or more chronic illness. And that's according to the CDC. That's not just an arbitrary number. And over 50% of our clinicians are reporting some sort of burnout, whether it's being overworked, underpaid, or just having a limited level of treatment options available to them. And lastly, it doesn't really turn into a data problem. We don't struggle with data, but we do struggle with turning that data into actionable insights, something that people can actually do with all that data. We've got wearables, we've got blood work, we got labs out the yin yang, but until they can turn it into actionable insights, there's nothing to it. So what if we could change all that? What if for our patients, we didn't look at them at a some of their symptoms, but we looked at them as a whole system? And we were able to treat them at the root cause rather than treating what's layered on top of that. And with all that data that we have, what if we could crunch it all down to really understand people at their genetic level to see what makes them them? So that now when they're looking at the lab work and wearables on top of that, they're not looking at medians of a whole bunch of people that have done this test before. They're looking at what's actually right for their specific biology. And what if we could ease the burdens on clinicians by taking hours and hours and hours, sometimes days and weeks, of lab analysis work away from them, giving them a fully automated, readable report that gives them clinical details, it gives them recommended protocols to move forward, and it does this in less than an hour. Well, welcome to Nexus Health. At Nexus Health, we're leveraging the power of AI to do just that. And at the root of it all is our biomatrix AI synthesis engine. And what the biomatrix AI synthesis engine does is it takes raw DNA, raw lab work, pulls it together, looks at up to 1 million genetic markers in 10 biological domains, and really creates a precise roadmap of how to repair someone's biology, making their systems work better, treating them at the human level. And this isn't something that we just came up with and is not really in practice today. We've actually already been in trials with this for a long time and implemented it. So, to share one of those patient studies with you, let's talk about an autoimmune case that we had with chronic inflammatory demyelinating polyneuropathy. Now, this patient has had this disease for almost 20 years. It's a progressive disease. This isn't a disease that gets better. And this neuropathy really causes a lot of issues. And it presented in this patient in a way where they lost a lot of mobility. First, they had to start using a cane, then they had to move to a walker, and finally, they were wheelchair bound, having to use a power wheelchair, not even a manual wheelchair, a power wheelchair to get around. And they came to us and worked through our biomatrix report and got a protocol for this individual. And this protocol, they worked for 7 weeks and we did a retest to see how things were going. And you could see based on the results, the comparative analysis on screen, there has been marked improvement across all the biological domains that we looked at. It's really quite impressive. And now this patient has been continuing the protocol and they've seen amazing improvements in their quality of life. This person is out of a wheelchair, off a walker, and back to needing just unilateral support to get around. And I'm not just making this story up. This isn't just some random person. The story's about me. I'm this person. So while I may be the CEO of Nexus Health, I'm also one of the original patients of Nexus Health. So I've seen what this can do firsthand. Now, to walk you through a little bit about how the biomatrix system works, I'm going to pass it over to John to give you a little overview. John?
Thank you, Steve. So the biomatrix analysis engine is a patent pending AI that utilizes multiple agents. Each one of the agents is responsible for a dedicated input and output. Once the analysis is run, it's then pushed through a secondary analysis where all of the mismatch detection, the risk assessment, protocol generation, and safety validation is all reanalyzed. Then the final report is produced along with the actual patient protocol. All of this is built in to one single system. It's separate from where we keep our PII. But what's really, really unique about our engine is that what normally takes days, sometimes even weeks, to generate a detailed report like this, we do in less than 20 minutes. We're not trying to build an engine that replaces doctors. AI is not going to replace doctors. What we're building is an augmentation for doctors that will use AI that will end up replacing doctors that don't.
Thanks, John. Very powerful stuff that we can do here. And biomatrix is really just the start of this whole system. We actually are a complete package. So, biomatrix being that core report that pulls out raw DNA and lab results into a singular report is one thing. But BaselineONE is the way that the clinician and the patient can interact with that biomatrix report. They can track their progress, they can talk to each other, they can give each other updated protocols, updated symptoms, all those things. So, it's a continuously learning system. And then we also have our our couple simulation engine. Our couple simulation engine takes two biometrics reports, pulls them together, and then we can look at things from a giving people the best chance for fertility success and also for better family planning. So, like I said, this is not a vaporware product. This is something that exists. It's real today. You can use it today. You can log into BaselineONE. You can access reports. You can upload your data this moment. And we've built a world-class team to make this thing happen. We've got former DoD capabilities. We've got former Wells Fargo capabilities. We've got an aerospace engineer building this product. And this is all backed by clinical analysis. We have a clinician on staff helping us to make sure this is 100% accurate every single time. And of course, because it's biology, risk and compliance are critical to making this successful. So we brought in someone that is fully HIPAA compliant and understands everything to go along with compliance here in the United States. So if you're interested in that, join us to decode biology and define health.